like almost to the point where I was going to die. And the one doctor came in after like so many tests, and he's like, I just want to do a urine test, and if it comes back that she has uric acid in her urine, it means that she has this medical condition. It doesn't necessarily mean that she can't live like a normal life, but it just has to be managed and medication, and she can go about her daily life. But like peanut butter, all things high in
Oh my
protein.
God. How did you like not die?
Well, it came very close to it. I was a code blue, so that's like pretty close to like you can get. I had pretty much half the hospital. If anything ever happens to me and you forget everything and you just kind of like, I laugh and say, if you just kind of go dumb and you forget everything for a second and you don't know what to do, and I'm like passed out on the floor, like blacked out, like unresponsive, and I say, just remember when you take me to the emergency room or wherever you're going to take me, I'm like, just say, I just need an ammonia blood test. I said, that one sentence is going to mean life or death for me. Like, that's what I say to everyone, because I'm like, and I know for so many other people, that's such a huge thing, just to have that one other person to be able to share your story with, and like, they understand what you're going through, right? It's very easy to tell your family, it's very easy to tell your friends, your best friend, but they don't understand what you're going through, right? But when you have that one person or those 5 people, right, that you can tell it to, and they understand, and they've been like, hey, I've been there, I absolutely understand what you're going through, it does make the world of a difference. A lot of times too, like I can just tell within minutes if I've crossed that line of like I've eaten too much protein, like my body just like in so many ways will tell me, and I'm like, yep, okay, don't do that again. Yeah, and I can't eat it. I tried twice, and I was like, oh, I'm never doing this again. This is horrible. I'm like, this is horrible. Like, I felt terrible afterwards. I was like, never again. Like, oh no, I usually eat a quarter of a burger and then I leave the other half, because that's like my instincts. Even if I want to keep eating it, I'm just like, nope, don't do it.
I'm I'm surprised you have that kind of self-control.
It's hard sometimes, but yeah.
It's impressive, honestly. Just you just eat looking at the burger and you just have to stop putting the burger to your mouth. Like
Yeah.
that's hard.
So, like, if you're not eating, right, it thinks you're starving yourself, so it'll start eating muscle in your body, and muscle is pure protein, and it just kind of works. It's like a vicious cycle that all works kind of against
It's
you.
your body's literally like trying to kill you.
Yeah,
Like that's
yeah,
horrible. It's like horrible design.
yeah.
Hello, welcome to my podcast, to Mics One JoeySooch. I am JoeySooch, and I'll be giving advice to Autumn. She currently has a rare disease called, I'm gonna just do this one time, Ornithine Transcarbamylase, OTC deficiency, or they call it OTC for the remainder of the episode. Her body is unable to remove nitrogen in the form of ammonia in the blood. We all know ammonia is bad for anybody. We'll dive way more into it in a little bit. How are you today?
Good. How are you? Thank you for
I'm
having me.
Yeah, I'm excited to do this rare disease. I always love to learn about new rare disease and why in the world it exists.
Mhm.
So while I was doing research, I found out it's extremely uncommon in women. But here I am interviewing one. I already interviewed another one, so I guess I'm pretty lucky in the rare disease space.
Yeah, there's quite a few women. I haven't met too many men that have it, but there's quite a few women that have it.
Well, I can definitely tell you that most men probably have it, but it just will never they would never, you know, advocate for it.
Yeah, for sure.
So like the other woman I'm talking about, her name is Amy Engler. Maybe you know her.
Yes,
Um,
I yeah.
yes, she was great. It was a great episode in it because I am in it. Duh. She found her diagnosis by eating a roast beef sandwich and entered a coma and flying in a helicopter to save her life. But this is not about her. This is about you. So what is your story of how you were diagnosed? And since it cannot be immediately diagnosed if the doctor did not know what to look for.
Yeah, so I was diagnosed when I was an infant. So it was a few weeks after I was born, and my parents were giving me formula, and I couldn't keep anything down. And of course, baby formula is high in protein.
Oh
So
no.
I mean, it kind of was like this vicious cycle of they were like, what's going on? This is really weird. So when they figured out what it wasn't until probably I got so bad that they took me to the emergency room, and then the one emergency room said, okay, we're sending her to another emergency room because we don't know how to handle this. And then they didn't know how to handle it, so then they sent me to Toronto, which is like an hour drive from where I was living, and they like rushed me there. And yeah, when I got there, I was like really bad, like almost to the point where I was gonna die. And the one doctor came in after like so many tests, and he's like, I just want to do a urine test, and if it comes back that she has uric acid in her urine, it means that she has this medical condition. It doesn't necessarily mean that she can't live like a normal life, but it just has to be managed and medication, and she can go about her daily life. And lo and behold, he did that test and it came back and that's what it was. So, and that was after like them feeding me like peanut butter, all things high
Oh
in
my
protein.
God. How did you like not die?
Well, it came very close to it. I was a code blue, so that's like pretty close to like you can get. I had pretty much half the hospital in my room working on me. So
Oh
yeah,
my God.
I came pretty close.
Yeah, for the people that are not following the story, so her condition is that she has a lot of nitrogen in her blood, and that's, I think it's double. For one, you're not supposed to have protein. You're supposed to have a very low protein diet. But the thing is
Yeah.
that they don't know that, so they're giving her what like what any other normal baby would do, because when you're a baby, you're always hungry and stuff. So like
Hmm.
they were trying to save your life, but at the same time they were like killing you.
Yeah, yeah. And like when I got to the hospital, they thought it was like a peanut allergy. Like they thought it was some sort of allergy. So I remember my parents saying like, "Oh yeah, they were feeding me like peanut butter, nuts, like all these things that were like super high in protein that are like just like a big no-no for anyone with my condition." And yeah, my body just went into like almost like a state of shock, right? So my body didn't know what to do, and I started having like seizures and just yeah, because my body didn't know how to handle it. Just was like this, what is going on? This is too much. Like I don't know what to do, and it basically was starting to shut my body down. And like I said, it wasn't until the one doctor came in, did the last test after so many tests were run, and then they were able to figure it out and give me the right medication and
I'm just
treatment.
kind of surprised he was like, hey, let's see if you have this rare disease. And
Yeah, yeah, I know. I was very surprised too because from what my parents told me, it was like they went to, like I said, two different hospitals and they didn't know what to do with me, how to handle it. They had no idea what this was. It wasn't until we got to Sick Kids Hospital in Toronto, which is like a very well known hospital. He was this one very well known doctor and he came in, I guess, after like so many people trying to figure out what was going on. And yeah, I just say like I owe everything to him, basically.
seems almost like a normal test that should have been done in the beginning.
Yeah, I know. You would think that. Like, I always say to people, like, I've said to, like, my fiance, all my family, I've said, if anything ever happens to me and you forget everything and you just kind of, like, I laugh and say, if you just kind of go dumb and you forget everything for a second and you don't know what to do and I'm, like, passed out on the floor, like, blacked out, like, unresponsive, and I say, just remember when you take me to the emergency room or wherever you're gonna take me, I'm like, just say, I just need an ammonia blood test. I said that one sentence is gonna mean life or death for me. Like that's what I say to everyone because I'm like, you could know everything about it and everything about this condition, but then I've seen and I've heard stories where people get to the emergency room and it's like their family member or their friend forgets everything and it's just like their mind and they're like, what do I do, right? Because you're in a like state of shock and you don't know what to do, or you're just like running on adrenaline and you're like, I just need to like, get help for this person. So
Yeah,
I
like
kind of always say that. I'm like, you forget everything else, just tell them to do an ammonia blood test right away. That's the first thing they need to do. Because I always say the minute they do that, they're gonna see that the ammonia in the blood is like really really high, and then they're gonna know, okay, we need to get an IV in this person, and then that is the difference between like you have that small window of helping that person or them getting further and further into like a state of like slipping into a coma or God forbid, like dying or something.
Is it safe to say that you have no long-term damage from your ordeal you had to suffer through?
Yeah, pretty well, I would say, yeah. I mean, I do have a learning disability, but I mean, for the most part, I would say I'm not really affected from it. And I mean, I haven't really tried to let it affect my life. Like, I mean, obviously, it's a part of my life. It will always be a part of my life. And I've just kind of, over the years, as I've gotten older, just kind of tried to embrace it more than anything and make it a part of my story and who I am and share that with people as much as I can. And I find for me, that's such a huge thing. And I know for so many other people, that's such a huge thing. Just to have that one other person to be able to share your story with and like they understand what you're going through, right? It's very easy to tell your family, it's very easy to tell your friends, your best friend, but they don't understand what you're going through, right? But when you have that one person or those 5 people, right, that you can tell it to and they understand and they've been like, hey, I've been there, I absolutely understand what you're going through, it does make the world of a difference.
Just for the audience to understand, when you have high ammonia level, it weirdly enough, it does not affect everyone the same age. So Autumn was saying that it affected her basically at birth, but some have experienced symptoms when they're in their teens or even adults, which is extremely strange. Since she was an infant, it includes refusal to eat, poor suck, vomiting, progressive lethargy, irritability. This disorder may rapidly progress to include seizure, diminished muscle tone, and a large liver, respiratory abnormalities. Affected infants and children may also exhibit the accumulation of fluid within the brain. In other words, not good stuff. So it's kind of safe to say you're pretty lucky that nothing bad happened to you after all of that.
Yeah, I always say knock on wood. I'm pretty lucky. Despite all of my health stuff, I've been fairly healthy for the most part, right? Like I've been the last time I was in hospital was and in hospital for like high ammonia level would have been probably almost 6-7 years. It's been a while, and I say knock on wood all the time because I'm afraid I'm gonna jinx it. Yeah, for the most part, I've been pretty healthy, and in that way, I would say I'm pretty blessed because I know other people where it's like they're constantly in and out of hospital all the time, like having to deal with those experiences, and it's not a fun experience at all. Like it's not like, I mean, it's very hard on your body when you have to go through that, and it's physically draining.
Like, so you have the disease now, but doesn't it seem kind of the person's fault if they do end up in the hospital? Because, so for the audience that doesn't understand, so let's talk about what you need to do. So, two big things you have to change is your diet and your medication. So, let's go with your diet. So how much protein can you have in a day?
So for everyone, from what I've learned over the years, is everyone's different with this condition, and everyone there's a certain number that everyone kind of has that you kind of gear towards, and they also go based on what your dietitian or your medical staff are telling you, and also what your labs are telling them. So for me, for the most part, I don't really follow like a strict low protein diet. I've always kind of followed the diet of I eat what I want, I watch what I eat, and just manage like how much I eat. So I do eat like things. I'll eat meat and I'll eat cheeses and I'll have like things like fish and stuff like that. But am very careful of how much I put into my body, how much I eat, and I'm constantly like I might not be writing it down, but I'm constantly like mentally in my head being like, okay, I had this much like of an egg, or I had this much cheese today, so I can only have this, right? So I am kind of keeping track in a way, but I mean, I know for some people they strictly only follow like the hospital diet where they're on like the hospital food that they're given. And I know for others they're okay like having a regular diet and then just modifying it as they go kind of thing.
So it seems like it's saying that each person is different in terms of diet and more of a trial and error kind of what their limits are or what they can eat.
Yeah, it really is. And again, it's really about how much your body can take in. Because I know for me, like, as the years have progressed, I've kind of learned, like, okay, I can eat a little bit more of, like, if I want a burger or something, right? Like, maybe, like, once a week I might have a burger. But any more than that, like, I know that that's kind of stretching it for me. So whereas for someone else, they might be able to eat more or not at all, right? And again, it's very different. I've talked to so many people that it's like, they're like, yeah, I'm strictly on the hospital food. Or they're like, yeah, I do half and half kind of thing.
Do you know right away when you're eating too much, or you just more of an educated guess of, hey, I'm just gonna stop here?
It's a bit of both. I would say it's an educated guess based on, like I said, based on how much I'm eating throughout the day. I'm kind of like mentally tracking. A lot of times too, like I can just tell within minutes if I've crossed that line of like I've eaten too much protein, like my body just like in so many ways will tell me, and I'm like, yep, okay, don't do that again.
Yeah, just for the audience, her diet is kind of from day to day, so she has to have X amount of protein per day, and it kind of resets every single morning. So it's like terrifying just to read the side effects of it, because obviously I don't want you to get in a coma, and like if I had it, I'd be like, no meat at all. I want to like be healthy and stuff. So
Yeah,
it's a little, I know it's probably easier for you because you've been living for a long time, but it's always like scary reading this diseases because you always kind of go to the extreme end of like, I'm never going to eat meat, and like, I don't want to like go in a coma, I don't want to get seizures, and like it could cause long-term damage. So that's
yeah,
scary. Like I wanted to say, to like, to give an example, Amy, I think protein count was like 50-ish per day. So I'll just assume, let's just say you're at like 7. It seemed like your level is a little bit higher because it seemed to be that you can eat a burger, which is pretty good.
yeah,
But like I did want to give examples. So like a single shrimp is 15 grams.
yeah. So like shrimp, I love shrimp. I cannot eat shrimp because shrimp does not like me. Like I learned that very quickly, right? That's one of the foods I can't eat. I love it. Like put
Yeah,
some butter on it.
like if you do, so if your level is 70 and shrimp is 15, that's like 4 shrimps, and that's your entire
Yeah,
protein for the day.
yeah. And I learned very quickly. Like I love shrimp. I like butter and garlic. I love it. Like I can sit.
That's what Amy said too. She loves shrimp.
Yeah, and I can't eat it. I tried twice, and I was like, oh, I'm never doing this again. This is horrible. I'm like, this is horrible. Like I felt terrible afterwards. I was like, never again. Like honestly, like it was a gross feeling. Like I was like, this is not worth eating 4 shrimp.
No, it's insane to be it's such a small food too. Like it's not like if you have it part of a meal, it's not really the main part of the meal, and
Yeah.
that could just kill you. Do you have like a guilty pleasure food
Ooh, that's a hard one. A guilty pleasure food.
or something you're not supposed to have, but like you just love the taste of it?
I love like as I've gotten older, like I've started trying new things. Like the other day I tried like chicken nuggets from like Burger King, and then I've had like
Wow, that's pretty ballsy.
I know, I know. And then I've had like I don't know like burgers from like McDonald's, which I love. I'm like I probably shouldn't, but I do it anyways.
Oh no! I hope your doctor's not listening to any of this.
Oh, they know, they know. They all know. But no, like I mean, as far as like my guilty pleasure, I would say that like those are probably my guilty pleasure. Anything McDonald's, like I love McDonald's, but yeah, that would be my guilty pleasure for sure. Like I know when you were saying about the ammonia number and it like everyone having an ammonia number, like I know recently when I had blood work done, the average what I was told is the average ammonia level number is between like the 50 range kind of like that's normal. So like I know the last time I had my blood work tested, it came back like mid 50s kind of thing. So they were like, okay, that's good, right? And they knew what my diet was, and they're like, you're doing good. So I was, well, that's good to hear.
I'd be like petrified to be a doctor right now.
Oh, they all know me. They know, like they honestly like. I mean, and that's the thing. It's over the years because of this, I've been very like trial and error in the sense of like food. And I've also picked up cooking as like just a hobby, and I love cooking and I love baking. And because of my dietary restrictions, it's kind of taught me and made me learn more, right? Like I'm going online and I'm looking up recipes, I'll go into the grocery store and I'm looking at nutrition count and portion sizes and things like that. But then also too, because I did that starting when I was so young, kind of like cooking my own meals and stuff, and my parents taught me a little bit of that, and then I kind of just kept going with it. Now, like when I go into the store or something, I know like, okay, I don't reach for this loaf of bread or like these bagels because I know like that's higher in protein, right? And like sometimes I'll have people be like, really? Like it's bread. Like isn't all bread? And I'm like,
Mm-hmm.
no, like you don't understand. Like even pasta, like I recently, a couple months back, I showed someone, I was like, how much protein do you think is in this? They're like, oh, next to none. I was like, no, there's like 11 grams for like 1 cup of pasta. So I'm like, if you have like a full bowl of pasta, which is like the equivalent to like 2 to 3 cups of pasta, like that's a lot of protein. I'm like, that's where I kind of switch it up, right? So if I want something like that, I'll have that maybe once, twice a week, and then the rest of the week I do something different. Like I'll do like veggie noodles. Like I'll make like sweet potato noodles, or I'll make butternut squash noodles and make that into like a pasta. And I know I can eat as much as I want, and it's got no protein in it.
So like you talk about like your guilty pleasure of like eating a burger. So do you like eat the entire burger, or do you like just eat like a quarter of a burger, satisfy your senses, and then
Oh no,
eat?
I usually eat a quarter of a burger and then I leave leave the other half because that's like my instincts. Even if I want to keep eating it, I'm just like, nope, don't do it.
I'm I'm surprised you have that kind of self control.
It's hard sometimes, but yeah,
It's impressive, honestly. Just you just eat looking at the burger and you just have to stop putting the burger to your mouth. Like
yeah.
that's hard. Because I know you have a family, but like, how do you deal with family and their diets? Because I'm assuming your family are normal in terms of they don't have OTC. So like, do you cook? And then you say you love to cook. So do you cook yourself and then they just eat whatever you eat, or you cook separately, or like, how do you guys handle that?
Like normally, if I'm going to a family dinner, I just kind of like say if we're having like a spaghetti dinner or something, and we're having, I don't know, like spaghetti and meatballs or something, right? And it's like Caesar salad or something like that. I'm just trying to think off the top of my head. I would go there and be like, okay, well then I'm gonna have pasta with like just like plain sauce, and then I'll have the salad, and then they'll do like, for me, like my aunts will know, okay, don't put any bacon in the salad for her, don't put any cheese, and I go and make my own little salad. But for the most part, like I don't really like make it a point to kind of like make my own meals when I'm at family events. I really try and eat as much as I can of whatever is there. And if there's not an option, then obviously I do bring
McDonald's burger.
yeah, then obviously I do bring my own option or I try to make something. But for the most part, I mean, my family's been always very supportive and good that way. Yeah, I mean, I also make it a mission to, because I know there's, when you go certain places, you're not always going to have that option, right? So I've
Hmm.
kind of, over the years, just made it a mission of mine to be like, okay, well, just work with what you got and kind of go from there.
Yeah, so it just seems like that they're not really accommodating you. Maybe they'll have a plate or two that you can eat, but they don't fully accommodate you, and you to take the responsibility of I can only eat this or that.
Yep.
So it's good. Yeah, sometimes it is nice that they do accommodate you, just because you don't have to worry either. So I feel like I see your condition almost similar to like an allergy.
Mm-hmm.
Too, like they have to like tell you like you mentioned like bacon and a salad, like that could, I guess, one plate of that salad would like to kill you and put you in
Yeah.
a coma. Nobody wants that.
Yeah, exactly. And they've all seen me when I've been at my worst and been sick. And I mean, they know what I go through. So, I mean, they obviously don't want that for me.
Yeah.
And
What happens when you eat too much? Let's say eat too much of your burger. Like what starts happening to you?
a lot of the times I'll just throw up what I've eaten. My body just knows to like get rid of whatever's in me. So I'll usually start throwing up. Sometimes depending on the like how much protein I've eaten, like if it's say like really bad and I'm like starting to get high ammonia, like I'll get headaches, I'll want to go lie down, or like a big thing is you won't know like your surroundings. So like my family and my friends will know to ask me like if they notice I'm starting to act a little bit funny, they'll be like, "What's your address?" or "What's your name?" or like, "Who do you live with?" Right? Just simple questions. And if I can't answer those, they know that something's going on. So then they know to kind of like, okay, let's give her like ginger ale, or like give her things that are high in calories that'll help, and then kind of go from there. If I need to sleep, I'll go sleep, or if I need to go to the hospital, then kind of go from there and see if I need to go to the hospital.
Isn't going to sleep not a good thing? Like, I feel like you would want to. So it is that you're just kind of waiting for the body to do its thing to feel better?
Yeah, so again, like I said, it really depends on how high your ammonia level is in your bloodstream. Like obviously if I can tell, like, because I've had this so like over the years and had it for so long, I can tell kind of for the most part when something's really wrong, and when I'm like, okay, I need to go to the hospital, like there's not, or when I'm like, okay, this is something I can kind of manage at home, right? So like a big red flag for me and my family and my friends would be if I can't keep anything down. Like if I can't keep liquids down, I can't keep any food down. That's a huge red flag, because the minute I can't keep calories in, it'll make your ammonia level spike even more. But again, I know you said about the sleeping part, but sleeping is like another thing. If you go too long without sleeping or eating or taking calories, or you're not getting enough sleep, your body gets run down. So then it starts eating the muscle, and muscle is pure protein.
Oh, no.
Yeah, so like if you're not eating, right, it thinks you're starving yourself, so it'll start eating muscle in your body, and muscle is pure protein, and it just kind of works. It's like a vicious cycle that all works kind of against you.
Your body's literally like trying to kill you.
Yeah,
Like, that's
yeah,
horrible. It's like horrible design.
yeah. So like a lot of the times, if I'm not feeling well, or I can just feel like something's off, I'll go and like have a ginger ale, have something that's like high in calories, and then I'll go lie down and try and like. And a lot of the times it's just I'll go have a nap for like half an hour, and I wake up and I'm fine, right? And all I needed is that good sleep and my body to rest, and I'm fine. But then other times it needs more. Like I have to like go and change all my medication and take out like the milk that's in the one medication and make it all like low protein and make it so that it's like the emergency medication. But I only do that if I can't keep anything down, kind of thing.
Yeah, I'd be like terrified to be around you. Like, like, because my mind's going to. I guess it's easier if I live with you for a long time. But
Mm-hmm.
like the last thing I want is you to be in a coma. It's like, what if she's in a coma but not sleeping? I don't know what's happening in your body. Like, I'm just gonna be freaking out the whole time.
Yeah.
Like, shit, and I'll be terrified.
And you know what, you say that, and that's not the first time I've heard that either. I've heard that from other people.
Yeah, like if I was dating you and I saw you eating the burger, I would like throw it out the window or something. Like, what are you doing? Like,
Yeah, so when I started dating my fiance, like that was the first thing. Like, I kind of like, I think it was second date, maybe even first date. I kind of just laid it all out on the table. I was like, "Look, I have all this." I was like, all joking aside, I come with a lot of baggage. I was like, so, but I mean, he's really supportive, and I mean, he's constantly like reminding me to make sure you do this, and make sure you do that, and like on me about things. So I mean, it's good.
I don't know. He must have high blood pressure all the time or something. So let's talk about the medicine. I know you have a video online and it looked like you just stole a box of medicine. So like, what medicine do you take to like control your symptoms other than controlling your eating habits?
Yeah, so I take a drink that I make 3 times a day, or sorry, I make once a day, and it's three drinks for 3 times a day. So I drink it in the morning, the afternoon, and before I go to bed at night. And what it consists of is water, and then I'll do milk, this powder that's called Pro-Free powder, which is basically there's no medication in it. It's just kind of like a supplement, vitamin, mixture, and it's meant specifically for people with like OTC and urea cycle disorders. So it's basically if you're missing certain things in your diet, this will help, kind of thing. And then so I'll have that mixed in with citrulline, which is another medication I take, which again helps with my ammonia and breaking down any protein, all those fun things. And so I blend that all together, and then I have the 3 drinks throughout the day. And then I also take, in a plastic syringe, I take Ravicti, it's called. So it used to be called sodium phenylbutyrate. It's now changed to Ravicti. It's just a liquid that's in a syringe, and I take that 3 times a day with my blender drink as well. And that kind of helps to, like, again, with keeping my ammonia level down, and just like it helps with mostly with the ammonia level. That's one of the main medications I have to take, and one of the most important ones. And then I take this one's not a medication, but it's kind of like a supplement type of thing. It's called amino acids, so essential amino acids. So it's kind of the things that you would find in like dairy and stuff, and all the things that I can't eat, right? Like things that are high in protein would have amino acids, and basically amino acids build muscle. And so I take this powder and mix it in with like a drink or like applesauce or something. So I'll take that 3 times a day, and then just everyday vitamins, and that's pretty much it.
Do you like feel like it's helping in a way? Like did this like when I take like cough medicine and such, like within an hour I feel better? Do you have the same kind of effect?
It's funny you ask that question actually, because so before when I was on the sodium phenylbutyrate and I took it in pills, I noticed that sometimes it didn't work, as like it took longer to work in my body, and I could feel it, right? And now, like if I feel like I'm off and I'm sick, like something's not right, and I feel like my ammonia level's like going up, kind of thing, and I go to take my Ravicti in that syringe, I can almost instantly, like, it sounds crazy to say, but it almost instantly can feel it working in my system. And I truly believe, like I've said this to the people that make it, I've said this to my doctors, I truly believe it's because it's a liquid, right? And it's not having to break down within the body, and then it's not having to do all that extra work. It's already liquefied, and it just has to now go through your system. So it gets there a lot quicker.
Yeah, I think I kind of figure out the same way with like when you eat and then you drink water. Like the water just disappears so fast, but like food stays there for a long time.
Exactly, right? And think about how long it takes your body to break down food. It's just like, I know when I used to take the pills, like I was like, oh my gosh, like this feels like it takes forever to, and sometimes just trying to even take those, like I used to take 22 of those pills a day in one blender drink, and I used to have to blend them. And then when I was sick, if I couldn't drink that drink and keep it down, I would have to take those just by mouth, right? So one by one, take 22 pills. Like, that's a lot of pills to take, and they weren't little pills, and they weren't easy to swallow, and they didn't taste great either. And everyone I've talked to who has this is like, agreed 100%. They're like, yeah, I'm so glad they changed, because it's not easy to take. Like, I know many times being sick and just being like, nope, I can't do this, and like being in the hospital and pushing away the bottle of pills and being like, I can't take this, like it's gonna make me vomit. Like,
Wait, so you're saying that you used to take 20 pills a day and then you switched to this liquid form?
Yeah, so I used to take 22 pills a day in the blender. So in my blender drink that I would make once a day, I would blend 22 pills into it. And the thing with that too is, right, I would blend it into my blender drink, and I would find I wasn't always fully getting all of the medication, because sometimes it wouldn't blend all of the pills.
Mm-hmm.
It was stuck in the bottom too. So that was another thing that was kind of like, oh, this is a pain. But yeah, now I just take the 3 syringes. I take 4 mils a day. And I mean, it's also great because it's very convenient too. Like if I'm going out somewhere, I just pre-fill them, put the caps on them, put them in my purse or my bag, and I'm good to go. I don't have to worry about carrying around all these bottles with me, which is like awesome.
I mean, it would be embarrassing. You like open a bottle and it like falls all over everywhere, and they're like
Yeah.
trying to catch it.
Yeah.
No, that is crazy that you have to take so many pills. I do feel like you. I feel like you like living life on the edge.
Um, Yes and no. I mean, like, I don't know. I've just
Um,
kind of learned to accept what I've been given, right? Like,
yeah, and then so like you go from 30 pills a day to the 3 pill. So I'm guessing you take not the 3 pill, but the liquid. So I'm guessing you take the same time every day.
yeah, pretty well, yeah, for the most part.
So do you take it like is it similar to like an insulin shot where like you take it before
No,
you have a meal?
no,
But
it's
not like an insulin shot as in you ingest it, but in terms of like you have your liquid before like a meal or like after or just
I've kind of done both. You're technically supposed, according to the bottle and what I've been told, you're supposed to really take it with food. Sometimes I've done it without food if I'm out somewhere and I don't have that option because I look at the time and I'm like, well, if I don't take it now, then I'm going to be off for the next one. So I
mhm.
just do it anyways. But now that my body's like been taking it for so long, sometimes if there's that odd day or two where it's like I don't necessarily have food in my stomach, but like I take it, I'm fine. But for the most part, it does say that you should take it with food.
But you say you take it 3 times a day. So what happened if you take it another time? So like if you had a burger, like we mentioned before, like your diet has to be like you don't pay attention too much to your diet, but you still pay attention to it. So like what
Hmm.
happened if you did accidentally eat more? So can you take like a 4 pill? I mean a 4 liquid shot, I guess.
Yeah, nothing would really happen. I mean, I have done that. I think I did that once by accident because I was like so tired the one day, and I was like, I did. I had so much going on, and I forgot, and then I was like, oh no, I forgot to take my medication, and then I was like, wait, I took it already, and I didn't realize till I went to bed that night. But yeah, I mean that's where it's fine. It's more so if you're taking like over like a bunch of days and you're like constantly doing it all the time, that that's where you would see the difference, kind of thing, right?
Yeah, so are you just basically saying that like you know your limits are, and then if you're just eating, I guess a regular diet for yourself, you really have no symptoms at all.
No, for the most part, I don't really have any symptoms. I mean, the odd time I will get like headaches and stuff, which can be related to high ammonia, and I sometimes they go away, sometimes they don't. I mean, there's been times where I get a headache and then within half an hour it's gone and I'm fine. And sometimes it can be as simple as like I said, I just need to go lie down because I'm tired and I've done too much in that day and like and my body's just like, okay, like go sit down, like dude, like this is too much. I can't handle this.
So I always wanted to ask about healthcare because it's always a different answer because I know you live in Canada.
Hmm.
So like, was it easy or difficult for you to be getting your medication? Because I hear stories where it has been difficult to get medications for free.
Yeah, I mean, for me, it's been pretty easy for the most part. So I've been lucky that way. Like just yesterday, I just had to phone and order like a bunch of my medication and everything, and they're like, okay, yeah, that's fine. It'll be delivered tomorrow. And I was like, okay, great, thanks. So I mean, I can't complain in the sense of like the way like the healthcare system is here. Like I have no complaints. Obviously, like at times, like it gets a little bit busy, but I mean that's like everywhere. I feel like, but yeah, I as far as like getting my medication and stuff, I've never really had an issue with it. Like I've never run into an issue, and I've kind of always kept on track of it too. So that's been helpful as well.
Yeah, it's really awesome because like in your case, it's really a life or death situation if you don't get your medicine.
Yeah, I think there's only been like one time when I was like really little that I remember. I specifically remember when I was a child, my parents phoning down to the hospital and trying to order my medication, and they're like, we might have to call you back in a bit. We're not sure if we have it." And they're like, if we don't have it, you might have to come down here and get it. Like, meaning I might have to come down there to Toronto and like get it through an IV kind of thing. So like that would be worst case scenario, but I mean, my doctor and my healthcare team has always been really good in that sense. Like even like there's been like maybe one or two times in the past where I'm like I phone them like late and I'm like, I just realized I'm running really really low. Like And like, I know at the start of the pandemic, there was one issue where I phoned and they're like, oh, we might be running low on product. And I was like, what?
Oh no.
And so, but like within a span of 24 hours, they were able to turn around and get me like almost a year's supply. And they like pushed it through and like got my doctor to write the prescription. And because they knew I was running so low that I was like to the point where I was going to have nothing left,
Mm-hmm.
I said to them, I was like, well, I can come down there and like pick it up if you want, or like, and I could tell they were trying to like avoid me going down there too with COVID and all that, right? They didn't want me coming into the hospital, but yeah, they turned around and within like, I think it was like 24 to 48 hours, they were like, okay, we're sending it out, like it'll be out there like by tomorrow, next day, like so you're good. I was like, okay, awesome.
Oh yeah, that's awesome. It's just it's terrifying, I guess, when you're at the end of your supply. Like you need this stuff.
Yeah. So, I mean, I try and keep a very organized, like, I always have kept, like, in one area of my house, I keep it all in one spot. I don't ever move it. I tell everyone I, like, live with, I'm like, don't move any of my stuff around. And I try and, like, keep it all, like, the labels facing out so I can see everything. And I, like, not constantly, but I'll go in and, like, when I'm doing my medication for the day or whatever, I'll always, like, keep an eye on how low I'm getting, right? Like, the other day I noticed on one of my medications I was running low, so I was like, oh, I better call because I'm like, I know that's one of the ones I need to actually, like, they need to phone and get a prescription for. It's not just off the shelf, so
And
that,
you have a system, and you like it to keep it the same way.
yeah.
So we're gonna go in a totally different direction. So you are 30ish now, and you have an X-linked disease. For the people that do not know, an X-linked disease means that it was spread to her daughter to the X chromosome, while the son cannot get it. So what is your chance of having kids?
Yeah, so as far as having kids, like from what I've been told from my healthcare team, it's not the table. Like I can have children if I want to have children. Obviously, it comes with some risks, like just like any pregnancy would come with some risks. But I mean, mine would be a little bit higher. Mine would be considered a high risk pregnancy, but at the same time, my doctor has turned around and said I've had very successful patients and many patients who have had babies and had full term pregnancies and been fine, and mom's been fine. And like, I know she explained to me that there was one case where she had someone, and all that happened was, I shouldn't say all that happened, but I mean, basically the mom's ammonia level went up after giving birth because she was doing something very strenuous, right? So she was like,
Mm-hmm.
her body was getting very tired, which is common. They turned around and they just gave her like IV fluids and everything, kept an eye on her, and she was fine. And everything was fine. They went home, baby was fine. Like, so I mean, and as far as like planning and all that, I've been told that I can like find out, I can get a certain test done and find out at, I don't know the exact date, like how long it is, but at a certain point in my pregnancy, I would be able to find out if the baby has OTC or not, is a carrier. And at that point, you can then choose whether or not to carry on with the pregnancy or to terminate it.
So since you have the disease, what would you do?
That's a really hard question. I've kind of always said to people, like, I think I would really have to be in that situation because, like, I think it would change, right? Like, at that point, like, I don't know how emotionally, like, I don't know how I would react once I know there's a living being and a baby inside of me, right? I don't know if I can really answer that, to be quite honest. I don't know. Like, I don't know what my answer would be. And I've kind of said that to everyone because, I mean, it could change in the moment, right? Like I could, and the minute you see that there's that living being inside of you, I might not want to terminate it, but at the same time, like who knows, right? If I am told like the child has OTC, or if I'm told, right, like, and when you have that test done, you're also told, like if you want to be told, you're told what the gender of the baby is. So if they turn around and say it's a boy, right? Boys are, their lifespan like is not as long usually in most cases, and normally they get it more severe than girls. So I really don't know how I react, because, like, yeah.
You're giving me the vibes that you will probably know, but like you won't. You'll just have the baby anyway because now you have like an emotional attachment to it, and you can't say no now.
Yeah, I don't really know, honestly.
Yeah, I get it. It's a difficult decision. It's like, do you want to have a healthy baby, but you also don't want to give a baby a disadvantage on
Yeah.
purpose?
And I think that's really something, too, that, like, I also have to consider, like, obviously it's my choice, but I also have to consider the person I'm with, too, right? Like, their choice
Hmm.
as well, so.
I mean, I get, but you have a year supply of medicine, so you're in good hands.
Yeah.
So before I take a mic away from you, is there anything you want to say, promote, any words of wisdom? The mic is all yours.
I don't really have any words of wisdom. Uh,
You could say anything you want. You know, you can
just say, yeah,
say the lottery numbers if you want.
just thank you for having me, and thank you for allowing me to share my story. And I'm just trying to share my story with as many people as I possibly can, and just raise awareness and hopefully help people out. And I know, like, make more relationships and more friendships out of this. And I've already created so many friendships because of some of the advocacy work I've been doing. So again, thank you for allowing me to share my story.
Yeah, so thank you, Autumn, for giving me your time. Thank you, everyone, for listening and watching. All her links to her social medias will be in the description below. Thanks, everyone. I'll see everyone next time. Bye.